It's a normal aging process, and sometimes you do find certain diseases, for instance, diabetes mellitus, can cause cataracts. People who are on steroids, long-term steroids, even as used as puffers or oral steroids or topical drops, can produce cataracts. But usually it is an age-related process. Usually after 50s, but sometimes it can affect earlier also. Just last weekend I operated on an 18-year-old young man, but he has a congenital cataracts right from his birth. Patient usually complains of decreased visual acuity, seeing in the distance, seeing the street signs, traffic lights become blurred. They have to come really close to the street signs to see them. They may have a lot of glare, particularly at night time. Particularly in the people who are diabetic, their cataracts, their vision in the broad daylight is much poorer as compared to the night time. And when we diagnose, we dilate the pupil and we can see with the microscope or a slit lamp that the lenses are cloudy. There is no particular criteria to say when the cataract surgery should be done. It all depends on how much the person's ability to function has been affected. Usually 20/50 is the normal vision for driving with both eyes open. If the vision goes below that limit, and when they're approaching that limit, we'll say yes, have the cataracts operated. But some young people may complain of a lot of glare, seeing properly, and I usually tell my patients, if your lifestyle is affected and you cannot function properly, that's the time to have your cataracts removed. Cataract surgery these days takes about 20 minutes, 15-20 minutes to do. The patient is, when they present to the cataract suite, the nurses will go take the short history, compare the medical history prior which has been taken in the office, and then they'll prep the person, and we use the dilating gel to dilate the pupil. The pupil must be well dilated for us to do cataract surgery. Then they come to the pre-op area where the anesthetist goes over their history, checks them that everything is appropriate. We have anesthesia assistants who also look at the person, and I, as a surgeon, will go talk to the patient again, and we put the dilating gel to dilate the pupil. Then we'll position the head properly on the operating room table and explain to what will happen during the surgery to the patient. Then we'll take them into the operating room. The patients are wide awake because we give them very mild sedation to make them calm and comfortable, but usually majority of the time it is a painless surgery. And I tell the patients that talk to me if there's any pain or any problems. If some persons do complain of some extra pain, then we can give them some more anesthetic to avoid the pain. The major complications are that at the time of the surgery, if there's a posterior capsule rupture, the cataract can fall back or the lens can fall back into the eye. And if that happens, that's a major complication, and the person has to be referred to a retinal surgeon to do a vitrectomy and also take the lens out posteriorly, and they still get the lens implanted in the eye. That's one of the major complications. Second major complication is infection. And for the infection, we usually start the patient on an antibiotic before the surgery, a few days before the surgery, anywhere from 1 to 3 days before the surgery. So that is the second major complication. But the incidence is very low, whereas infection rate, in my own practice, my own hands, is less than 1 in 5,000. Majority of the people are extremely happy. Within a day or two, their vision should be 20/20. People who have high astigmatism, in those cases, or people who have got higher refractive errors, they might need some glasses. Usually we try to make them as independent of the glasses. But I usually tell and always tell the patients that for the best vision, they will need glasses. We try to make them what I call as a quotation marks, independent of the glasses, that they can drive without glasses. To some extent, they can read the larger print. But anybody needing the best possible vision, they will have to have the glasses. Cataracts come back only the next life. They don't come back in this life when they have removed it. Yes, sometimes it happens that we leave the posterior capsule intact. There could be some fuzziness in the posterior capsule developing in about 5% of the patients over a period of time. If that develops, the person will complain of blurred vision again. And that we can use a laser to create a small opening in the posterior capsule, and the visual acuity recovers. Immediately after the cataract surgery, we usually provide them a plastic shield to be worn in bedtime for 1 week. During the daytime, they can wear any kind of glasses. we usually tell them not to lift more than 20 pounds of weight for about 2 weeks, and then 50 pounds of weight for another 1 or 2 weeks. Otherwise, they can do practically everything. If there are no complications, as we don't put any stitches, there's no harm in bending forwards. Previously, we used to tell them not to bend forwards because the wound could open up. But now we don't restrict those. Yes, we will restrict them from going on to the gym or going to the swimming pool because of the risk of infection. Otherwise, they can start their normal life. Cataract study program at St. Joseph's Hospital. I'm very proud of it. We have made it as a premier institution. Our cataract suite is very well organized. The patient flow is very good, and extremely good care is given to the patients. Patients are very happy with the nursing staff, and our other outcome of the cataract suite is extremely good. We have 2 residents per year in our residency program, and residents from PGY3 start going into the cataract suite to learn about the cataract surgery. With that, we also have a wet lab in which the residents are trained before they go on to the human eye how to do the cataract surgery. Our training program, in my opinion, is one of the best, and particularly the surgical training program is the best in the country. We hear from the residents from across the country that the surgical program at St. Joseph's Hospital at IB Institute is the best.